Today we're discussing diabetes insipidus, which is a disorder of the posterior pituitary gland. Now, one of the hormones that's stored and released by the posterior pituitary gland is the antidiuretic hormone, ADH. And this hormone is also known as vasopressin. So if we break down antidiuresis, anti means against. Diuresis means increased urine output. Therefore, antidiuretic hormone usually works against diuresis, and it does this to regulate fluid levels in the body. Now, diabetes insipidus happens when there is too little ADH in the body. And so because of what ADH already does, we know that if there's too little ADH in the body, there is going to be increased urine output. So the anti is no longer able to happen because there's too little of it. So the patient is going to have increased urine output, which means they're going to be peeing a whole lot. Now, causes of these include head trauma, tumors, surgery, radiation, and honestly, even central nervous system infections. Big signs and symptoms to watch for in your exams. Try to relate the symptoms to the pathophysiology of what's going on. So we're saying that the patient is going to have a lot of urine output because there is too little ADH in the body. So one of the signs and symptoms is going to be polyuria, which just means increased urine output. And somebody who's peeing a lot obviously is going to be thirstier than usual. So another sign and symptom is polydipsia, which is increased thirst. The patient is always thirsty. Now, when you have increased urine output, the urine is less concentrated. So one of the symptoms we see is decreased urine-specific gravity. Now, with less concentrated urine also comes decreased urine osmolality. Okay? Now, when the patient is losing a lot of urine and a lot of fluid, one thing we also encounter are blood pressure issues. Think of a patient who's dehydrated. So we might see them have a low blood pressure. They may feel like their heart rate is faster than usual. Obviously, dehydration, which can also lead to weight loss, muscle weakness, dry skin. And a big one to remember, you're losing all that fluid, so hemoconcentration, which means the blood is thicker than usual. So you might see some of those blood levels higher than expected because a lot of fluid is being lost in the urine. Now, diagnosis is usually made by something called a fluid deprivation test. And what happens here is the patients will abstain from fluids for about 8 hours. And then after that, the blood and the urine osmolality will be assessed, as well as their vital signs and weight. And we're looking for all those signs and symptoms we just talked about in slide 3. If this test fails, a vasopressin test may be done. And this is when IV vasopressin, which is the same as ADH, is given. And the reaction of the patient's body to this vasopressin is monitored because they're trying to see if the body is going to respond to the ADH or the vasopressin the way that it's supposed to. Another diagnostic could be an MRI of the hypothalamus and the pituitary to see if there are any tumors or any dysfunctions there that might be causing the condition. And then a 24-hour urine collection, not necessarily a diagnostic tool, but it's a tool that might help in the diagnosis of diabetes insipidus. Now, as the nurse, what is your responsibility? When you see this on your exam, you're thinking, how am I going to help this patient? First of all, we're going to weigh this patient daily. Remember that when you're weighing a patient, you want to weigh first thing in the morning without clothes on because we want an accurate dry weight. You're also going to monitor the urine output because these are some of the signs and symptoms the patient is having. Urine-specific gravity, you're going to keep an eye on that. Blood pressure, heart rate, and the fluid and electrolyte levels as well. You may find yourself administering medications like desmopressin or vasopressin, so you teach the patient that these medications are lifelong. They will be taking it for the rest of their lives. Now, you also want to educate the patient to report any weight loss, weight gain, increased thirst, increased urination. They need to avoid foods that are going to cause increased urination and monitor their fluid intake and urine output, because whenever they go visit the doctor, they will most likely be reporting all of these things to the doctor. So I hope this helps you to understand diabetes insipidus a little bit better. If you have any questions for me, make sure that you leave them in the comments so that I can answer them promptly for you and help you to gain some more clarity. Okay, until next time, don't forget to subscribe to this channel and turn on your notifications so that you know when a new video is available. Alright guys, have a wonderful day. Bye-bye.